Hello and welcome to another Alzheimer Society of Calgary Facebook video. I am Samantha Ray, one of the support services workers here for the Alzheimer Society of Calgary, and with me today is...
I'm Paul Bartel. I'm the manager of learning and support services here.
So we've decided to switch things up a little bit, and I'm going to be asking the questions here. And what we're going to be focusing on is the report that came out from Alzheimer's Disease International in the fall of 2019. With this being Awareness Month for Alzheimer's disease, we thought that this would be a really good way to kick that off.
Yeah.
So I guess, Paul, what is this report? What's the important pieces about it?
Well, the report is on attitudes towards dementia. And so what they did is they created a survey that was available online and in person in some places. And being true to their name, they surveyed 70,000 people worldwide about opinions and attitudes on dementia, trying to get at what do people think, where are we at in terms of people's understanding of and the stigma that we know is often related to dementia and people's perceptions of it. So
Excellent.
Yeah, it gives us, starts to give us a bit of a baseline understanding of where everybody's at, and as we see more and more initiatives around helping people understand dementia and the ideas of things like dementia-friendly communities continue to take off, are we going to see some subsequent changes to this kind of these opinions and attitudes?
Yeah, so hopefully it can kind of maybe give us some insight on how these initiatives should run or where their focus should be then maybe.
Exactly, as well as are we seeing change over time?
Excellent.
Yeah.
So I guess you said that there were 70,000 people that were interviewed worldwide. What does that population compose of?
Well, they broke it down. The people who took the survey were asked to sort of identify what kind of groups do they belong with. So are they somebody who's living with a diagnosis? Are they a family caregiver? Are they a healthcare professional?
Mm-hmm.
Or are they just somebody in the general public? So the results look at opinions and attitudes from those 4 different groups on a variety of questions and topics.
So then I think that there would be some different takeaways from kind of each of those groups in terms of what's maybe important to kind of focus in on.
Yeah, there's certainly, there's a lot of information about each of those groups, but some of the things that really stuck out to me, for the people living with a diagnosis, there's a very consistent theme in their responses of exclusion, of being left out of social activities, family activities, decision-making, being able to participate in a lot of different areas of their life, including at times when they still should be participating in those aspects of their lives. And so, I can't say I was surprised by that. We certainly have heard that, but it's quite something to see the stories that were shared of how people have been ignored and isolated by their families, by their doctors, by people in their communities. So obviously a lot of things, it's a very big and real issue, and a lot of things do need to change around those, the opinions and attitudes that lead to that.
For sure, right? Because I think definitely I can attest to the stories that I'm hearing, especially in those earlier stages. There's still a lot of abilities and people want to be included, involved, participate. So yeah, I think I would agree that it's not something that is overly surprising, but
what makes it very powerful is the actual, the people with dementia were encouraged to share their stories, and that's hearing and reading those stories is what makes it really powerful and impactful, moves it beyond just this is an issue to, wow, look at all of the different ways it is hurting people.
Yes.
Yeah.
Yeah, for sure. So what are some of maybe the other takeaways?
Well, in looking at responses from people in the general public,
Mhm.
what I found interesting is 78% of the general public is just concerned about developing dementia at some point in their lives. So it's a real worry and anxiety for people. And, you know, a lot of the reporting, a lot of the media about dementia these days is about the fact that with demographic changes, all of that, the incident rate is going to increase. So I think we can see that that is maybe driving a lot of anxiety for people, that they might develop this and that they're afraid of it. The other thing that I found really, really interesting is 25% of the general public thought there's nothing they can do to reduce their risk around developing dementia, which we know is not the case. There's a lot of emerging evidence of things we can do in terms of lifestyle and behavior that can help to reduce our risk. And so for me, that was one of the takeaways there is, okay, we need to really make sure we are trying to get that message out, that there are things that can be done. And, you know, going back to that first point of the fear people have about it is talking about the fact that, yeah, there's going to be some changes you might have to make and some things you need to do if you do get a diagnosis, but it doesn't mean that your quality of life needs to disappear overnight.
Yeah, I mean, I think I would definitely agree with that. I talk to a lot of families, and there are lots of ways to live well with dementia, and so it's just trying to figure out, okay, how do we do that?
And
so
yeah, and that's going to look, you know, unique for each person, but there are a lot of different strategies and ideas out there now.
Yes,
so.
Very much so. So yeah, that definitely is very interesting to kind of hear about how many people don't think that there's anything they can do to really help reduce that risk for themselves.
Yeah.
But I mean, there's so much information out there, and it'll be.
Yeah. We need to make sure that word is going to end. That what people are hearing about what they can do to reduce the risk is credible and you know, well informed, because that is, I think, maybe part of this too is there's a lot of conflicting information out there, and people aren't sure what to believe.
Yes. Yeah. So you had mentioned that healthcare professionals and practitioners were also contributing to this report. What are some of the takeaways from them?
Well, and this is where starting to look at some of the country by country breakdowns got really interesting for me. But the one that kind of stood out when they talked to healthcare practitioners in Canada, or when they surveyed healthcare practitioners in Canada, is that only about 48% of healthcare practitioners agreed that there are competent doctors for the diagnosis and treatment of dementia. And so when you're looking at a little less than half of the folks in the healthcare field saying, hey, we don't think we have the knowledge or enough knowledge and skill to work with this, I think it points to something that we maybe need to be having a larger conversation with around the various dementia strategies nationally and provincially about how do we make sure that the folks in that healthcare workforce know what they need to know to help with diagnosis and supporting people with dementia after the diagnosis.
Yeah, because that would have significant implications for families if
Exactly.
they don't feel that they're being supported by their healthcare practitioner, right? So that's definitely a very interesting number.
It is an interesting number, and you know, I think it points to a challenge for us here in Canada around how do we raise that level? How do we help the folks already in healthcare feel like they can be confident and ready to work with people with dementia?
Yeah, exactly. And so the last group really was those caregivers. And so what are maybe some of the takeaways that came from that report with regards to caregivers?
Well, what stood out for me there, again, looking at it in terms of the responses from Canada, maybe there's two things I should say in general. The first one is more than half the caregivers surveyed reported a lot of positive things about being a caregiver, that they did find, some meaning and importance in the role. It's very easy to have these conversations and get really focused in on the negative.
Yes.
And I thought that was a really important thing to note, that a lot of caregivers are reporting some positive aspects to being to having that be part of their life. But again, looking at Canada specifically, the number that stood out for me is that only 20% of caregivers agreed that there's adequate community services and supports for them. And that number seemed, is very low.
Very low, yeah.
And given that here at the Alzheimer Society, we're part of that community service and response, that I've been trying to figure out what does that number mean?
Yes.
What is missing? And that's where I find the language in the report on that question is unfortunately maybe not as specific as I would like, because it's not clear to me what that means. Is it that people are looking for more respite, day programs? Are we talking about transportation issues to help people get to appointments? What are people perceiving as the missing parts in that community services piece? Because without that, it becomes kind of hard to figure out what the next steps are.
Yeah,
so,
right.
yeah.
Because without that concrete information of figuring out, okay, well, what do these caregivers need in order to continue to support their person at home? What do we need to implement, right? So, and where do we need to put our focus and our monies, right?
And,
so,
I also wonder if part of that, because one of the things we hear very consistent is how complicated it is to navigate the system, to find the services that are available and get connected with them. That's a challenge we even have.
Yeah, even for myself, I don't always know all the resources that are available, and I'm not caring for somebody who has dementia. So, and I work here, so part of my job is to kind of figure that out when somebody does call. But if you're not sure that we even exist, where do you start? Who do you turn to call?
Yeah. So, I wonder if a part of that isn't also just that larger system navigation piece, which is a fairly complicated one to try and solve.
Yes, yeah,
So.
for sure. So with this report, I guess, what is the hope?
So the hope is, that in a few years they'll be able to redo something like this and gather more information, see what's changing, get some more information. But it also points at, here's some things we need to start doing right away. I think it really underlines the fact that there's still a tremendous amount of work to be done around the stigma of dementia, that there's a need for more and better education for people who will be working with people with dementia, so healthcare professionals and the allied groups there need more education. And one of the other things is, we need to see more advocacy. We need to hear the voices of people with dementia a lot more than we are. And I think this report helps with that. And I think there's some really encouraging stuff happening for that in Canada already. We've got the Dementia Alliance Canada is going. There's Dementia Alliance International, which are ways that those voices are starting to be heard. And I'm really hopeful that those groups continue to build strength and momentum.
Yeah, and I think they definitely will. I think here in Calgary, we definitely have a lot of very passionate individuals living with the diagnosis, as well as care partners who really want to make a difference and make that change. So I think it's definitely going to be really exciting to see how it moves forward, for sure.
From here, yeah.
Excellent. Well, thank you very much, Paul, for giving us
Sam.
some information. And thank you for joining us today. If you have any questions or suggestions on what topics you would like us to talk about, please feel free to leave a comment in the Facebook comment sections, or you're welcome to give us a call at 403-290-0110, or you can email us at findsupport@alzheimercalgary.ca. We plan to be back in 2 weeks where we'll have another topic to discuss. If you have any questions on any previous topics or on this topic today, you're more than welcome to give us a call. And we hope you have a wonderful day.